Okay, so we're seeing a global pandemic that has spiraled out of control. The response by governments has been different in different countries, but everywhere, what they all have in common is that they are guided by the logic of the capitalist system, where the interests of banks and corporations is sacred and the lives of human beings are not. And it could not be any clearer that this system is a threat to all of our lives. As of today, this virus has spread to every continent except Antarctica. It's in most countries on the planet. It has infected almost 650,000 people, and its spread is accelerating. And for now, it has taken the lives of over 30,000 people. And so far, the poorest countries have just begun to be hit. The devastation there is likely to be unimaginable. Adults of all ages are at risk of getting this virus. In Europe and the US, half of patients admitted to the intensive care units are under 50 years old. In countries with major outbreaks, hospital systems are completely overrun. Medical staff make up 20% of hospitalized patients. In Italy, medical workers have been forced to implement wartime protocols of catastrophe medicine, where healthcare workers must choose who to save and who to let die, knowing that they may be the next patient. In Spain and France, the situation looks the same. Spain is using ice rinks to store dead bodies because morgues are full. All funerals have stopped, and everyone dies alone. New York City hospitals could be worse than Italy, with its morgues already reaching capacity. Many healthcare workers are filling out their wills and writing letters to their children in case they never see them again. Hospital workers are working without protection, wearing trash bags, splitting ventilators between multiple patients, and now hospitals are the best place to become infected. Many US cities are heading towards the nightmare that is unfolding in New York, and this is the so-called richest country in the world. There was nothing inevitable about this tragedy. A few countries have shown it is possible to get the spread of the virus under control. Governments simply needed to act quickly to test widely and track and isolate cases. This is textbook response, Epidemics 101. This is what Hong Kong and Taiwan and South Korea did. They have all been able to keep their death rates very low. But ultimately, the type of response was hardly determined by concerns about human life. No, for every government, the type of response has been determined by the same capitalist logic. What will this mean for the economy? What will this mean for the profits of our corporations and banks? Or as Trump shamelessly said to the whole world, will the cure be worse than disease? In other words, is it worth it to damage the economy in order to save lives? For capitalism, what is its moral compass, its calculus of catastrophe? It's always the same. Capital, investment, profits, economic strength, not human life. For the few countries that responded quickly, their calculus was the same. If we don't stop this virus, our economies will be more devastated. For Hong Kong, they had no choice. They're one of the most densely populated countries in the world, closely connected to China. A mass outbreak would have devastated their society. In Taiwan, it was the same. The government knew the island's economy would be quickly overwhelmed by a mass outbreak. They had to act fast, and they were prepared. They quickly blocked flights from China and started testing. And for South Korea, it was no different. Its capital is one of the most densely populated in the world. As soon as large clusters were identified, South Korea rapidly unveiled a massive testing and tracking operation. If they didn't act fast, their economy would have been in crisis. For now, their outbreaks are under control with low death tolls. But so far, these countries have been the exception, not the rule. So far, every other ruling class has made a different calculation. From China to Europe to the United States, they chose to wait and see. Why? Were they ignorant of the economic threat of pandemics? Of course not. Their scientists are among the world's best. Their choices were made with full knowledge of the risks, but their economic concerns told them to wait, disrupting flights, restricting travel, mass testing, and mass isolation. That cure may be worse than the disease they thought, so they waited. In China, where it all began, they waited too long. In China, of course, the regime was concerned with an outbreak and the impact it could have on the economy, and especially with the reaction from their population. For years now, the working class in China has been a powder keg with record levels of strikes, all of which have been met with intensified repression of activists. There's no telling when a movement could erupt and threaten the regime. The Chinese government waited over 5 weeks before imposing any kind of quarantine and admitting to the world there was widespread human-to-human transmission. By the end of December, in response to grave warnings from lab scientists, technicians, and doctors that a new SARS-like virus was spreading within the city of Wuhan, the government arrested those who spoke up and forced them to sign statements admitting to spreading rumors, saying it was a threat to the country. They publicly denied all evidence of human-to-human transition, and China did not impose any real quarantine until January 23rd. But they did not ban travel around the Chinese New Year, which is the largest annual human migration on the planet. Many of the 3 billion trips that take place throughout the country during this time had already begun. By then, it was too late. The virus had already spread to other cities in China and several other countries. Within days, the city of Wuhan would be overrun, and the ultimate death toll would be over 3,000. And even today, accusations abound inside China about the underreporting of new cases and the total deaths. Time will tell. And now, instead of serving as a lesson, the hesitation of China has been repeated and exacerbated throughout Europe and in the United States. The opportunity for a rapid intervention came and went. Italy and Spain have become the crystal balls of misery that await many countries. In country after country, we are seeing an Olympics of failure, and the US deserves the gold medal. Before the virus, in the United States, economists worried about an economic downturn for months. Record levels of corporate debt had piled up. The stock market was being kept afloat through bubbles of speculation. The tiniest economic disruption could tip the economy over the edge. This was the biggest cause of delay for the US. The US identified its first patient on the same day as South Korea, on January 20th. While South Korea responded quickly, in the US there was no response whatsoever. On January 30th, the US imposed a completely porous restriction on travel from China. Chinese citizens were blocked from entering the US, but other passengers were only screened for coughs and fevers. Without testing, screening does practically nothing with this virus. It can spread for weeks without symptoms. Another 30 days of community spreading goes by and nothing happens. Meanwhile, in South Korea, the largest mass testing onslaught was underway. Within 2 weeks after the first case, South Korea was testing more people per day than any other country, testing 40 times the number of people per capita than in the US. Tests are done there in 10 minutes and results are back within an hour. But in the US, by the time the virus was all over the world, still nothing. On February 29th, when the US marked its first death in Seattle, South Korea had already begun cutting its new cases per day in half. The US hadn't even tested more than a couple hundred people, and all those tests were likely invalid. The US didn't even have a working test until March 3rd. And by then, the window to stop the spread of the virus had closed. The US had gave up on any sort of mass testing. Testing was being done mainly on those with severe symptoms who would be admitted to the hospital. Testing was not being done as a way to actually track the virus and limit it. But if you were in the NBA or a Kardashian-like pop star or some other millionaire or politician, you could get tested immediately. Trump even called that kind of class inequality just the story of life. Even today, to get tested, you have to be highly symptomatic, and tests can still take 5 to 7 days for results. Remember, it takes an hour in South Korea. It's no wonder that now the US has the most cases in the world. What this means is that the disaster happening in New York and Louisiana is likely to be repeated in many other cities. For years, the healthcare system in the US has been gutted in the interests of profits. Public hospitals have been closed or suffered massive budget cuts. All hospitals have been stripped to the bone in the interest of productivity. On a normal day, hospitals are already at capacity, emergency rooms already full, and workers are now having to reuse masks to spray them down and store them in brown paper bags because of the extreme shortage. Healthcare workers have been forced to risk their lives, the lives of their families, coworkers, and patients in the hospital. It's difficult not to focus on the complete idiocy and malice of Trump. But make no mistake, every politician at every level is guilty of waiting too long to act, of caring more about capital than corona. Even now, most states are not on any real lockdown. Many people are working without any real protection. New outbreaks have been confirmed in warehouses and grocery stores. Governors and mayors waited to close schools, waited for weeks to issue quarantines. When universities finally shut down, all students were sent home without any testing. Mass transit continued in cities for weeks without any change. And now Trump is trying to force workers back to work before Easter. The catastrophe is far from over. There's nothing unique in all of this failure. Putting the economy first is par for the capitalist course of destruction. Whenever there are catastrophes from hurricanes or earthquakes or fires, investors see new dollar signs amidst redevelopment and mass displacement. Little is done to relieve the victims of the tragedy. Little is done in advance to prepare. Despite decades of warnings from scientists about the threat of a pandemic, no real attempts were made to prepare for it. The US can do preemptive strikes in Afghanistan and the Middle East, but capital is incapable of a preemptive strike against a virus if it means striking against profits. And we see the same sick logic in their economic response to this crisis. The government has already granted around $6 trillion to banks and corporations, while the vast majority of workers receive crumbs at best. Unemployment is approaching at least 30%, and this week marked the highest unemployment filing in the history of this country, 3.3 million claims in 1 week. Latest stimulus bill offers some relief, $1,200 per adult and $500 per child. It's a one-time payment for 1 month only, along with $600 increase to unemployment benefits for 4 months. It's better than nothing, and it will make situations easier for some, but is pathetic compared to what we need. No worker should have to lose a dime. In order to end, I'd like to give a quote from John Steinbeck in his novel Grapes of Wrath, his indictment of US capitalism during the Great Depression. There is a crime here that goes beyond denunciation. There is a sorrow here that weeping cannot symbolize. There is a failure here that topples all our success. Nothing could be more true today. Their system has committed crimes that go far beyond denunciation. Their system has caused a tsunami of sorrow to crash upon our shores, and all of the so-called success of the capitalist era has led to this nightmare, another complete and utter failure of their system. This failure is clear for all to see, and their crimes are not going unnoticed. And there is a new anger that is growing in the population. And inside that anger, there grows an enormous potential for change.